Thanks for staying with us on Frontline this morning. Now we move on to the interview segment of the show. And just as we've said earlier that this month has been set aside as a month to create awareness about birth defects, and it's quite worrisome that after the journey of 9 months, which is the journey to motherhood, and it's begin with pregnancy, and the baby comes out with, whether you don't know whether you should rejoice, and it comes with mixed feelings, particularly when the baby comes out with some birth defect. And just like we say that the journey of motherhood begins with pregnancy, and every pregnant woman look forward to seeing is our child 9 months with so much joy and happiness. However, some women received this bundle of joy with mixed feelings, particularly when he or she is coming with some birth defect. And I think it's very important for us to enlighten ourselves on what are the causes of birth defect and how can mothers, expectant mothers, or perhaps prospective or potential couples try as much as they can to avoid or prevent birth defect. So joining us to have this conversation this morning is Mrs. Ayeba Meru Omobosede Yetunde. She is the Assistant Director of Nursing Public Health at the University College of Hospital here in the city of Ibadan. It's good to have Mrs. Ayeba Meru in the studio with us this morning.
Good morning. It's my pleasure to be here.
Thank you so much for coming again. So let's start with the basic and first understanding what birth defect is from the medical point of view.
Thank you very much. Just like the name implies, birth defects are changes, abnormal changes that occurs before a baby is born. In simple terms, that is just it. They are abnormal changes, physical or structural changes that are seen or that are being diagnosed in utero when the baby is still in the womb of his or her mother before the baby is born. So those are birth defects. Other people they identify it, or they call it congenital anomalies or congenital abnormalities. And a birth defect does not mean a baby a child is defective. We should not tag them as, oh, this child is defective because of a particular birth defect that he or she had. Thank you.
Okay, now we've talked about what it is, and before we talk about the causes, I think it's also important for us to look at the stages. So there have been a lot of questions as, okay, I think it has a particular trimester where a child gets to have a defect. So at what trimester are we looking at?
Okay, thank you very much. I would like us to know that birth defects can occur at any stage during the pregnancy. Yes, a lot of times it happens during the first trimester when there's something we call organogenesis, when the organs of that child is just being formed. So we see it a lot at the first trimester, the first 3 months before the child is born. But it's not limited to the first 3 months alone. It can occur at any stage during the pregnancy. Just like we said, it's an abnormal change that occurs as the baby is growing in the womb.
So are there causes for it? Like what really causes birth defects on the babies?
Thank you very much. I would like us to know that we can't like attach it to a particular cause, but we have what we call risk factors. Risk factors are what can predispose a woman to have a baby with a birth defect. An example is number 1. Let's talk about genetics.
Okay.
If there's a particular birth defect that occurs in either the man's family or the woman's family, a child has a higher risk of being born with birth defects. We call it genetics, or what some people call hereditary.
Okay.
We also have what we can call environmental changes. For instance, a woman working where they produce chemicals, that's what gives her economic power. That's where she works. She doesn't have a choice. So being exposed to these chemicals can predispose a woman to come down with a baby with a birth defect. A woman that smokes has a higher risk of having a child with a birth defect. Also, a woman that takes alcohol has a higher risk of having a child with birth defects. So all these factors, we call them risk factors. They can predispose a woman to have a baby with birth defects. Well, like I said,
so those lifestyles.
Yeah, those lifestyles, thank you. But that is not all to birth defects. Some, it just happens that we see the baby like that, with the mother not having any of those characteristics that I've mentioned. But with all these ones I've mentioned, a woman has higher risk of having a child with a birth defect. And it's possible for you to have a woman that has one or two of these factors and doesn't have a child with birth defect. Chemicals, use of drugs, illicit use of drugs can also pose a woman to have a baby with a birth defect.
Okay, in your line of experience, what are the misconceptions or myths you've heard about birth defect, and how do you address them?
In this part of our environment, Africa generally, sometimes, or let me say a good number of times, some people, they attribute a particular illness, a particular condition to
village people.
Let's use that term. Or somebody's enemy, or village people. So some people may be like, this kind of a child is actually from the devil, that kind of a thing. So they attribute it to a spiritual attack like that. Some people may also see birth defect as maybe a reward of what they have done. Maybe they had a particular sin. Oh, maybe because of what I did, because of what I stole in the past, God is now judging me, like a judgment on them. No. So people attach so many misconceptions, myths to birth defects, which are not. Some people may also believe that it's because the woman did not take a particular concoction, herbal concoctions, during pregnancy. Can you see what you have brought now? We told you to take that herbs. I go in quote in Yoruba. You didn't take. Can you see what? It is not because of that. In fact, we don't allow our mothers to take all these herbs during pregnancy. It can even be disposed to any of these birth defects.
All right. We are talking about birth defects, and from what I gathered, that birth defects are typically classified as structural and functional, and also structural or functional and developmental. Now, I would like to explain that and talk about some of the common birth defects.
Okay. Let's start with different types, like you rightly said. Some are structural, some are functional. Structural in the sense that the structure of a gene is being affected. There's a particular way development takes place in utero for a fetus. So when that process is being altered and the structure is being disorganized, there are structural changes. We also have functional ones. It affects the functional ability of that child in later years. Okay, now let's go to the types or the different examples. We have a lot of birth defects. You see, birth defect is they are what we see regularly when it comes to healthcare practice. We come across them regularly. We see them, and sometimes you want to commiserate with the parents of such children. It's not their fault. Now, what are the types? What are the examples of birth defect that we see around? There's something called Down syndrome. I know we'll be familiar with it. We can see it's a birth defect. We can see changes in the brain function of that child. We have what we call cleft lip and palate. Cleft lip and palate is, in fact, like 2 weeks ago, I still had a baby that had cleft lip and palate that was brought to UCH for, and the parents were like, they were so stigmatized that they don't want people to see the baby. They cover the baby, and we would like to advocate to our parents to don't keep them at home, bring them out to the hospital. There are treatments. There's a way we manage, babies like that. So cleft lip And palating means that there's a gap in the fusion of the lip and in the palate. We have what we call a palate at the upper part of our mouth, like the roof of the mouth. So when there's no fusion, when it's not joined and there's a gap, it can cause so many problems for the child. It's a birth defect also. Then we also have what we call club foot. Instead of the foot of the child, like that, to be pointed forward, is inward. So it's a defect. We have what we call spinal bifida. There's a problem with the spinal cord formation. There's a functional problem here. So the spinal cord is not well formed. And you see that baby growing up at the age of maybe 5, 6, 7, there are some milestones that baby will not be able to achieve. Even at earlier ages, there's something called developmental milestones. As a child is growing from, after being born, and child is developing, maybe like at 6 months, at 1 year, at 9 months, like that. There's something that child should be able to do. Like control of voiding now, urination. A child that has spinal bifida will not be able to control his or her urination because there's a problem with the spinal cord. And the spinal cord is in charge of controlling, sending message impulses to the brain and controlling voiding. Oh, I want to pee. Let me hold on. I can't pee here now. Let me just hold it. I'll pee on it. But for a child that has a problem with the spinal cord, that message, that impulse will not be sent. So the child can just pee anywhere. The pee just comes on its own. Inability to control urination, defecation. Imagine a child in school still wearing pampers. A 6, 7-year-old child, it can be so. This is a birth defect also. Spinal bifida. So we have a lot of them.
How about what you medical personnel call conjoined twin? Is that kind of different?
Very good.
Okay.
What we call Siamese twins. Conjoined twins. Yes. It's also a congenital anomaly. It is not normal for two babies in utero. In utero means inside the uterus. When they are inside the uterus, here we call them twins. But at the same time, everybody has they are separated. But when they are not separated, something is fusing them together. You've seen cases whereby some babies are fused at the abdomen, and it will take a very, how would I put it, a major surgical operation to separate them. It's a congenital anomaly. We have seen it, at least I've read about one that were conjoined at the head. They share the same. In fact, when I read it, and they grew without joining. When one is facing up, the other one is facing down. I know they are late now, they would have died, but they grew up to be at least older, very older, before they eventually died. So this also is an anomaly.
So they both died?
They both died.
Wasn't that the surgery was not successful? Or?
I'm not sure that they even had surgery for their own. But I know that they would have, by that time when I was reading about them, they were around 40-something years old.
Wow.
So I know, wow. I don't know how they eventually died. Maybe one died before the other. I didn't read the story up to that level. But I know that they were joined and they were always everywhere together. Imagine the kind of stress on the parents for them to have grown up to that
stage.
So for the parents, it can be very stressful. But there's what we call counseling for such parents.
Yeah, before we talk about the counseling and the psychological stress the parents have to pass through and some of the things we need to talk about as far as birth defect is concerned, because I think it's a whole lot of things a lot of things we need to talk about as far as birth defect is concerned. Don't forget that is what we are talking about this morning. I still have my guest in the studio with me. We'll take a break now and we will come back. The show will continue. Do stay with us. For being with us on the program Frontline this morning. And just like we said before we went on that break, that we are still talking about birth defects and prevention, and I still have Mrs. Ayebameru Omobosede Yetunde with me in the studio, and she is the Assistant Director of Nursing Public Health at University College Hospital here in the city of Ibadan. Yes, while we were having this discussion, what came to my mind was, sometimes when somebody wants to come down with a particular sickness, that might not be applicable to pregnancy and whole. There are some symptoms. Now, do we have signs and symptoms that the pregnant woman that, oh, this baby is an unhealthy one? Or are there some signs or symptoms or red flags that expectant mothers should look out for?
That's a very good question. Thank you, ma. And that will lead us to what we call screening. Because a lot of birth defects, looking at the mother, a pregnant woman, you will not be able to pick it, except for a few ones. For instance, there's one we call when the baby has hydrocephalus. It's also a congenital anomaly. Hydrocephalus means that there's so much water in the brain of that child, and then there's pressure. We see the baby's head very big. So in utero, you can see that some of those mothers, when they are pregnant, they have a very large tummy. Of course, a woman that is carrying twins may have a larger tummy, or multiple twin gestation can have a larger tummy. But sometimes if it's a single child and then the stomach is so big, what we call sometimes polyhydramnios, there's so much water, you want to suspect, I hope this baby is not hydrocephalus. But at a number of cases, in fact, majority of times, we don't know whether a woman is carrying a baby with a birth defect or not until we screen. So how do we screen? That's why I said it's going to lead us to how we screen. How are we sure that this woman that is pregnant is not having a baby with a birth defect? There's something we call prenatal ultrasound. Every pregnant woman must have this prenatal ultrasound done. For instance, where I work at the University College Hospital, there's something we call anomaly scan. At a particular gestation, at a particular age of that pregnancy, the woman will be given a form to go for anomaly scan. Anomaly scan means that let's be sure that there is no anomaly that we can pick. And we've seen cases where such birth defects were picked at those scans. So treatment commences, or the mother has to be counseled about what is inside her. So ultrasound during pregnancy, it is very, very important. Some birth defects also, as in, for instance, like heart conditions, heart anomalies can be picked with this prenatal anomaly scanning. So ultrasound scanning is very important for us to detect birth defects.
Okay, after you have picked, to borrow your word, the anomalies in the fetus, you say you cancel. So during those counseling, what do you suggest? Perhaps maybe, okay, you said there is treatment for it, but if for some, so for those that treatment cannot take care of, so what are the solutions, or what do you suggest at that point? Okay,
let me just, before I forget, now we've talked about scanning to identify what birth defect this woman is, or what that fetus is having. We can also have medical tests, blood tests, to detect whether some level of some hormones are higher or lower. We're able to pick some other things using a blood test. So now let's go back to your question now. There are some birth defects that can be managed in utero. In fact, technology has advanced that there are some operations that can be done on the fetus in utero. And also there are some that until the baby is born, nothing can be done. So for those ones that can be managed, in advanced cases, in advanced climes, where we can handle such, then treatment commences. But when this a particular birth defect cannot be managed in utero, we wait till the baby is born, then treatment commences. And let us know also that there are some birth defects that can only be managed. They can't be cured.
No treatment?
No treatment. They can only be managed symptomatically. Things like that. But there are some that surgical operations can be done, and then the baby is free.
during the pregnancy or after the baby is being
It
born?
depends on what the defect is. If it's what can be done in utero during the pregnancy.
So there are some defects that are so severe that you have to wait the baby.
Because you have to look at the risk to the mother and the risk to the baby also. So some, they tell the woman, we can't do anything until this baby's out. So we wait till the baby's born.
I've come across some defects that happens at the point of delivery. So is there the carelessness of the midwives? Because I have an example very close to me.
Maybe we should hear that.
Okay. Is that?
Maybe we should hear that.
Okay, that is very close to me. That when I heard about the story of the girl, that it was the hand, that the hand was curved like this, and it wasn't like that from all this previous scan they've had. That this was at the point of delivery.
Okay.
So are there some procedures or processes that happens at the point of delivery that will make a child to come with some defects?
Thank you very much. You know, where our mothers also go to at delivery is very important. If a particular pregnant mother decides to go to a very nearby facility where quacks are the ones managing, where people that are not trained or qualified are the ones managing. We have seen a case whereby a woman was laboring for hours. She was already in distress. The baby was already in distress, and they still wanted to bring the baby out by vagina. This woman couldn't push. She was so tired, and the baby was also having distress, which could, at the end of the day, both of them could be lost. And when the baby was eventually born, this is the true life story. When the baby was born, the baby had, severe birth asphyxia, not enough blood, not enough oxygen to the brain, and the baby was defected from that moment. So just like you rightly said, and that is why I'm saying that, where do our mothers go when they want to deliver? If you go to a place where we have quacks, they call themselves nurses, but they are not. We know them. There's nothing like auxiliary nurses. An auxiliary is someone that is not trained at all. A quack is a quack. So in a bit to ensure the baby is out, the baby is out to be out. Let's bring the baby back, who can cook. They can cause damage, in fact fracture to the baby. Some of them we want to do what we call instrumental delivery, that we use some instruments to bring the baby out.
Really?
But because they don't know how to use them, because they are not well trained, they have seen a doctor use it before and they were just trying to see how the doctor was doing it, and then they lay their hands on it, they can cause damage to the baby. So a baby that has been all right or in utero, now at the point of delivery, was damaged.
Okay, before we quickly touch down on the prevention and some of the risk factors for birth defect, let's talk about the parents, the mother in particular, because it breaks my heart seeing an expectant mother that after the journey of 9 months, the baby comes out and it comes with a bag of trouble that you are not even proud to carry the baby around and tell them that this is what you gave birth to. So the psychological stress, the trauma and all of that, how do you think they can manage it?
Thank you very much. It starts from diagnosis. And what do I mean? Once the screening had been done and then this baby has been diagnosed to have a particular health challenge, a particular defect. For instance, let's take as an example, a heart defect. There are so many of them. And then the news is broken to the parents. At that point, the healthcare professional must be very sensitive. This is not a need that you just break and say, madam, see, this is what we saw at the scan. See, the baby is having a heart problem, So, we see you in 2 weeks time, madam. No, this patient coming. No. This kind of patient needs a lot of time. Because breaking down news to her at that moment, you have said so many things. This is a woman that doesn't have any idea of what a heart problem is in her life, and now they have told her that he's carrying a baby with a challenge, in quotes like that. So the healthcare provider must be very patient and understand and empathic. Breaking this news. In fact, you can have a lot of hours spent breaking this news to these parents, because they need to ask you questions. They need to feel you, let me use that word, as a healthcare professional. So they need time to digest that information. And after that, they need adequate follow-up. Book them for the next appointment. Give them a call. If you know their residencies, go there and talk to them. Because if care is not taken, some mothers can do the unthinkable, in quotes, to themselves or to the baby. So adequate counseling, adequate follow-up has to be done.
The heart problem you mentioned made me to remember something. That is it the same thing you called hole in the heart? Because we have some babies.
Exactly.
Okay.
Most of the times, hole in the heart. In fact, it's a congenital anomaly.
What could have caused that, if I may ask?
That's what we call a birth defect. What is supposed to close up just fails to close up. What is the main cause of it? Nobody knows. But we have risk factors, like I've listed earlier. But thank God for technology. Technology is advancing, and we should take hold of this. Now we have surgical operations being carried out to make a repair of these conditions.
Okay, you mentioned something about
cleft lip and palate.
Cleft lips and palate the other time, and have there been any successful surgery to correct that, or what are the success story in correcting some of these birth defects?
Wow, that cleft lip and palate that you just mentioned, I'm so glad and happy and excited to let you know that even here in University College Hospital, I can mention it because I'm proud of that, there's a facility that handles the correction of that defect. So when the parents, they come to with such babies, like I said, they cover the baby up. They are not happy. You can see on them that they are already sad. But when they come, we lighten their mood. Take it easy. We have seen cases of surgical intervention for this cleft lip and palate done, in UCH, very successful. In fact, if I had come with a particular chart that we have, pre and post, when the baby was born with this palate, and now see what the baby is. In fact, if you are not careful, you will not be able to see that this baby had this congenital, this birth defect before. So thank God for successful surgeries that are being done. So I want to advocate, if we have cases of mothers with children that are born with cleft lip or palate, let them come to this University College Hospital. We have a session at our surgical outpatient SOP that deals with handling those children, preparing them for surgery. To the extent that even after that, there's a foundation that helps such parents, giving them a little fund to empower themselves to be able to take care of that child.
Aside the one we are doing now, because this is also for some form of enlightenment and sensitization on birth defect. So how do you expect, or other medical personnel, the government, different health stakeholders, to also ensure that people get more information on this birth defect?
Okay, there's something called awareness. We must keep creating this awareness. As healthcare professionals, as a public health nurse, that's my passion, and like I said, we want people to know. It's a major core of our practice. Awareness. Don't keep these babies at home. Bring them out to the hospital. So healthcare professionals, healthcare providers will ensure that they create awareness. They tell this pregnant mother, even right from antenatal clinics, they should let them know what they are supposed to do, what they are supposed to avoid, what can predispose them to the risk of having a child with a birth defect. So with all this awareness being created, mothers will be able to take adequate measures. For instance, if you know that this smoking or this alcohol consumption can predispose you to have your child to have a birth defect, you want to abstain from it because of the love you have for that child. But if a mother does not know and she keeps taking bottles every day, she can have a baby with a birth defect.
Okay, according to statistics, said about 94% of infants born with birth defects were reported to come from the middle and low income countries, and it also recorded 95% of the deaths of such children from birth defects. Do you align with this, and what will you say are the reasons for this? Because I know Nigeria is one of the low income countries that we are talking about, and it's a major 94% of birth defects happens in low income countries.
I would like to say that This can be attributed to two different reasons. Number one is ignorance. And then number two is what? Poverty. There's so much ignorance in the land. We attribute a lot of things to village people. We don't have awareness. We don't have adequate knowledge. You know, the Bible says that people perish for lack of knowledge. So this can be attributed to ignorance on our people's part. When we are pregnant, you don't know you are supposed to go for antenatal care until the baby is almost out. That is when some people, mothers should go to the clinic. And he or she is not the firstborn. I've been having babies, so what is it? This is not knowing that every pregnancy is unique on its own. There is no similar pregnancy. Then poverty on the other hand. I know we are going there now, prevention. One of the ways of preventing birth defect is what? Taking folic acid. In fact, pre-conception, before you get pregnant as a woman, you're expecting to get pregnant, start taking folic acid 1 per day. How many people are interested in even registering for antenatal? How many people are interested in getting folic acid and start using it? Or getting, all these hematinics, we call them, blood supplement drugs and all these things. If they say now this baby cannot be born per vagina, we're going to have a cesarean section, how many mothers
can afford it?
That is why that statistics can be attributed to what? Ignorance and poverty.
And okay, sometimes I wonder that even these antenatal clinics, some of them are free.
In fact, a lot of times.
So I don't know why people still find it difficult to present themselves for antenatal clinics, except perhaps the narrative has changed, which I don't think so.
It can also be attributed to ignorance too. Some mothers will prefer to go to their shop and open shop early than to go and sit down in the hospital. Yeah, some may prefer to do that. Or maybe go once and for the next few weeks. So it can also be a cause.
Before we talk about the prevention, since you've mentioned it, when we're talking about the misconception the other time, I think I forgot to add to it that some people do say that but there are some food that you should not eat during pregnancy. Because yesterday I was having a conversation with a colleague and he brought banana. I said, if somebody is pregnant now, they ask the person not to eat banana so that they will not have oka in Yoruba, but they call that thing that
the fertile will not close.
Exactly.
It's not. And it's true because we have some food misconceptions also. Being pregnant, I could remember when, before I got pregnant, we heard people say that pregnant women are not to take snails. If they take snails, the child will be drooling saliva. They should not. So I got pregnant. I loved snails. Wow. So I bought. In fact, I had a particular customer at Bulija Market. Till today, each time she asked me, "Customer, come on,
snails."
So I ate. I fried. I ate. I enjoyed it. My baby did not drool any saliva. So it's true that some mothers or some people might have attributed birth defect to the fact that the mother ate something. No, there's no food that a pregnant mother cannot eat, but everything should be done in what? Moderation. Thank you.
Yeah, and you said that, like I said, that it's also recorded 95% of the deaths of such children with birth defect. So birth defect can actually lead to mortality rates.
It can lead to death.
Deaths.
Yes, it can lead to death. In fact, we've seen some cases that ended. In fact, I had one yesterday. After a lot of surgical intervention, the girl still died. That girl will be around 11 years old. So some may not be in fact, some are not even compatible with life. Some birth defect, let's say that. Let's talk about some birth defect are not even compatible with living. So we see that if a particular birth defect, a woman is carrying a particular child with a particular birth defect, we have cases whereby that pregnancy will come down on itself. It may be because of a particular anomaly that the baby is having. So sometimes we hear of miscarriages. It may be because there's a particular birth defect that are not compatible with life, and then the body, has a way of eliminating such. So it comes down on it.
So aside that, the body has a way of eliminating such babies?
Some, not all.
Not all, some babies. Or like, I asked the question the other time, like, what would you suggest? Because I've heard people saying that the hospital sometimes also suggest that they terminate such fetus
at
that stage. And I understand, but I just want us to clarify that could it be part of the procedure, like professional procedures that could bring to the table for mothers that are expecting a child with BD?
Well, in this side of our own environment, we don't terminate like that. We don't, Oh, in advanced countries, they say, okay, maybe they let them just
take the baby out.
But here, we don't do that. Except maybe there's a risk to the health of the mother. If there's something that may take the health of that woman, and we can say that this is a danger to this woman's life. There's something called therapeutic abortion. If there's a threat to the woman's life, then they can consider such.
Okay.
They can consider such. But if there's no threat to the woman's life, we don't say, okay, now this is an option. Should we terminate the baby? We don't.
All right, so let's talk about the prevention. So how do we prevent it? Because prevention is very key, regardless of how severe or mild the situation is. So how do we prevent birth defects?
Thank you very much. The first step, we have danced around it. Prenatal care, antenatal care, very important. As a mother, once you know you are pregnant, don't wait till the 8th month. Go for antenatal care. Go and register. Go and book. And book at a facility that they know what they are doing. A government registered, a very good healthcare facility that they know what they are doing. Register there. There's so many healthcare facilities that infections that some people have, they got it from their facilities. Hepatitis B, HIV/AIDS, because of what? Unhygienic practices. Some babies have been damaged, major damage to their brains and everything because of what the mother gave, had such babies. So number one, book at a very good antenatal healthcare facility and ensure, don't just book, ensure you go for a visit. If they give you a 1 month appointment, please go. Prioritize your child and your life more than any other thing. So the first one is for go for antenatal booking and then go for follow-up visits. Whatever tests they tell you to do, please ensure you do them. And also, there's something we call folic acid. I've also mentioned it. Even before conception takes place, a woman should be on folic acid. And the way she has now, she's not pregnant now, she should continue to use folic acid till the pregnancy, throughout the period of pregnancy. Just 1 tablet per day. So this is very important. Sometimes women come to the clinic and they give them these drugs, and then you see that they just pile everything up with the fesolate and everything. They just pile them up and put them under their pillows. They're not taking it. I don't like it. It tastes somehow. It makes me vomit and all those things. Not knowing the benefit of all those things. So folic acid intake is very important. We talk about spinal bifida. When the baby may know when to wee or when to everything just comes on its own. This can be prevented, majorly by using folic acid. So good antenatal checkups, use of folic acid, very important. And also this ultrasound scannings that we have said. I normally scan at a particular age of the pregnancy. Make sure you have your ultrasound done regularly. And also ensure that you avoid, like what I said, lifestyle modification. Stop alcohol intake. Stop smoking. Illicit use of drugs. Stop it. Especially to chemicals. Avoid it. If it entails you to leave where you work for that purpose. Because all these things are toxins. They are like poisons to the blood. And they can affect, to a great extent, the baby in utero. So all these things should be done. And also go for genetic counseling even before you get pregnant, so that a counselor in that area will be able to know what are you predisposed to, what can the baby or can your baby come down with. A genetic counseling is very important also. So all these things are ways of prevention Of course, like I said, not all birth defects can be prevented, can be prevented like that. But at least the ones we know that knowledge has brought to us that we can do all these things to prevent. Let's ensure we do them.
All right, I want to say a very big thank you to Mrs. Omobosede Yetunde Ayebameri for this insightful time as we look at the birth defects and prevention. I'm sure you've heard it all. So pregnancy should be a thing of joy, looking forward to have a beautiful and a healthy baby, but sometimes somehow natural and just happen. There is no medical explanation to it, but for the one that can be corrected, for the one that can be treated, the onus lies in the hands of the expectant mother to do the needful by attending your antenatal clinics and also follow all the instructions and procedures as being laid out by the medical practitioner. So every expectant mother are looking forward to seeing those beautiful babies at the end of the day, but we must do the needful to ensure that our dreams are not cut short. Once again, I want to say a very big thank you to Mrs. Omobosede Yetunde Ayebameri for this wonderful time on the program. That's what you take on Frontline this morning. We'll see you again tomorrow by God's grace. Until then, my name is Temitope Oladipo. Do enjoy the rest of your day. Good morning.
Thank you.